The purpose of this tutorial is to illustrate a new way to place ancillary orders at the Health First Medical Group. In the customary fashion within Centricity, locate your patient's chart, strawberry shortcake in this example, press the Update button, and select the appropriate encounter type. Ordinarily, the encounter type is named Appointment/Referral Shortcut. Right now it is still slightly in test, hence the ZZ underscore, but ordinarily you would just select Appointment Referral Shortcut and press OK. You'll notice the Appointment Referral Shortcut populates, and there are numerous choices that you can make. For today's tutorial, we're going to focus on imaging, studies, and tests that are ordered within or without of the organization, including CT, cardiology, DEXA, MRI, MRA, mammograms, neurodiagnostics, etc. To access the proper form, simply press the red button. And the Ancillary Orders form will populate, where you're going to be ordering some type of imaging or diagnostic testing. Note the bottom. You must select one of the top radio button choices: Health First Medical Group Facility, Health First Hospital/Diagnostic Facility, or Outside Facility. The difference in these three radio buttons means that if you are a physician or staff member in the medical group and you are not sending your test to a diagnostic facility that is attached to a Health First hospital, press this radio button. If you are in the medical group and you are sending a diagnostic test to a diagnostic facility attached to a Health First hospital, you will press this radio button. And for anything outside of Health First, you will press this radio button. So for purposes of illustration, we're going to order a test that is from a diagnostic facility attached to a Health First hospital. And this would primarily affect the classic Health First Physician Inc. providers and staff. I'm going to press this radio button, and you'll notice that a number of pieces of information about patient information populates here. There are other action items that you can take. There's a place about insurance, but at the bottom it says you must select an authorizing provider. Now there is a drop-down list where you can select an authorizing provider. It also has typing ability, and for purposes of this illustration, I'm going to use Dr. Melody King and press Enter. Upon doing so, I get a new button, a blue button that says Provider Orders Health First. So I'm going to go ahead and click this blue button. And what will populate is the new Ancillary Orders form. Note the components of the form. There is a place for current diagnoses, prioritization of test, laterality if necessary, and then at the bottom we have modality of testing, any subsets thereof, and then a listing of orders will populate. The form warns me that I need a diagnosis and an order priority to actually proceed through the form. So in this illustration, Strawberry Shortcake has suffered some type of blunt head trauma, and I'm going to get a head CT, so I would come to the top and I would go ahead and select this diagnosis. Notice that this button changes to order priority, and I'm going to say I need it stat or same day. Now I've met the criteria to move on. Then I'm going to come to modality and to CT. I'm going to find head in this list, and I'm going to order an appropriate head CT. Once I've done that, I get an orange button at the bottom that says to commit this selected order and click it only once. So I'm going to click it one time. Notice how it becomes fuchsia. Now if I want to add additional orders, all I have to do is press this button. All of this data will clear and I can go back through this process. When I am satisfied with the orders that I have placed, I can come to the top of the form to the Orders module. Anything that I've selected will be here. As you can see here, it's already filled in my diagnosis and my test, and I can close the form in the appropriate fashion. If you have any questions about how to properly order imaging or diagnostic studies, please do not hesitate to contact the Department of Clinical Quality.